always wanted to be a doctor, and I was raised to consider service to others as a very important value. But mainly, I just thought it would be an exciting place to work. And when you look at rural medicine and the kinds of things that you get to do every day, it's an incredibly exciting field. And nowhere else do you get the true generalist sort of work where you can deliver a baby in the morning and then you're seeing an elderly patient with lung disease in the afternoon, and you're in an ambulance taking a patient to the nearest big hospital later that day. The variety is incredible, and the work is always challenging. So it was a good fit. I was right, it was an exciting place to work. So when I was fairly new in practice and my kids were little, I did a lot of obstetrics. And you'd always be running out and making sure there was someone there to look after the kids. And I had one day where I had done a delivery in the very early hours of the morning, say 6 a.m., and you've been up half the night and you're tired and you go home, and it was a weekend, so my husband was around, and one of the kids had a birthday party, and he took our son off to the birthday party, and I get a phone call from the hospital saying, your maternity patient is bleeding profusely and has just passed out, and we need you now. And so I loaded the two girls in the only vehicle we had at home, which was my husband's work truck, which was one of those big crew cabs with the four-wheel drive that I wasn't familiar with driving. And I blitzed into the hospital and left the girls in the truck and ran inside, and we stabilized the patient, and the patient had to go to Calgary. And in the meantime, I'm phoning my husband to tell him the girls are sitting out in the truck in the hospital parking lot, and one of the hospital staff went out and actually fetched them and sat with them till he was able to show up. And we did all the right things for this patient's particular medical condition and loaded her in the ambulance, and me and the nurse and the paramedics, we did a transfusion, we did some other treatments. And so of course by the time we get to Calgary, we got there so fast, we did sort of lights and sirens all the way, that the paramedics couldn't log in an accurate arrival time because they get reprimanded if they've gone too much above the speed limit. And we arrived on the ward with the patient and all the people waiting for her. And she actually looked so much better. They were going, well, this isn't as bad as we thought, you know? And what that did to me was, I mean, she did need to be treated there and she needed some surgical intervention to fix what was happening. But it really cemented the problems that we have with rural transportation of patients. And so that's been kind of a lifelong policy thing that I've been working on, is trying to improve this whole business of getting rural patients the care they need where they need it. And I think back to that particular incident, and it was just so scary, and it turned out so well, but you carry that with you forever. You know, and that patient went on, recovered, had 2 more children. You know, in fact, one of them was fixing my sink last week because they're working as a plumber. So you see this long-term relationship coming out of something that happened 20 some odd years ago, and it's amazing. Absolutely not. I never, ever intended to do all the leadership stuff that I've wound up doing. And what happened, and I think this happens to a lot of rural doctors, you see a need for something in your community, and you think somebody should do something about that. And you look around at who's there, and you realize that the person who's best able to do something about that is you. And so I started out writing letters of complaint to people about things that I thought should be fixed. And that led to invitations to be involved on certain committees or do certain things. I became chief of staff after I had one of my children, and I took my very brief maternity leave of 2 or 3 weeks, and I came back and found out they'd elected me chief of staff in my absence. And you fall into these things in a rural community. And I know in the city there are people who want these positions, and they run elections for these positions, and we've always considered it an obligation, and it's your turn to do it this year. But a lot of doors open through different things that happened throughout my rural career, and we wound up involved in some job action back in the late 1990s around call pay for rural doctors, and that led to me getting deeply involved with this organization, with SRPC, as well as with what's now Doctors of BC. And we brought forward rural issues in British Columbia in a very effective way. And it's been really a privilege to be involved in the development of all these programs that we have established to support rural medicine in our province. A lot of work we still need to do, but I think accidental leadership is common. At some point you become intentional. I decided this was something I could do, and I did run for certain positions and had to do elections and things because I thought it was a place I could make a difference. And that's been a very, very rewarding part of my life. Childcare is a huge issue for rural women in medicine, and I had sort of naively thought that in a small town it might be easier to find good childcare, and I had so many pieced together ways of looking after my children when I was young in my career. We did, at the time I went there, 24-hour call shifts. So when you were on call for a merge, you started at 8 in the morning, you went till 8 the following morning. And my husband had a job that he was out of town from Monday through Friday. And so I had 3 kids in 3 years, and I had probably 10 years of juggling care providers for my kids. And when you're tied up in a merge in a small medical group in a small community, you can't run out easily in the minute when something happens with your kids at school. And I was incredibly lucky eventually. There was a nurses' strike the year I had my first child. And I had a daycare provider lined up, but they had developed some family issues and kind of left me in the lurch. And so I was able to scoop up a high school senior who had planned on doing a summer job for one of the nurses, but they were on strike. So she came and did childcare for me. And a year after she graduated, she set up a daycare. And she has provided daycare for me, 4 of my now female colleagues in the practice, the hospital nursing staff, physiotherapists, kids went there. She's really focused on supporting the hospital. And I have to say, without her, we wouldn't have retained some of the doctors we've retained in Golden. And you think about this, what makes a life sustainable? And it's having someone trustworthy to help you look after your children when you can't be there. I mean, my kids have been at the hospital more than you can imagine. I took one of them on an ambulance transfer to Calgary with me when she was a little baby because I was breastfeeding and it was going to be an 8-hour turnaround and I couldn't leave her that long. And so we strapped her in her car seat into the spare seat of the ambulance and she did the transfer with me, you know. And that is not uncommon for people like me. I was the only woman in the practice initially, and certainly the only woman with kids at that period of time. That's changed dramatically, but that whole challenge of the most important people in your life deserve priority. and yet the mechanics of the job can make that really difficult. That's one of the reasons SRPC has always focused on providing childcare. You can't expect someone to come to a conference and be learned all this stuff and not have a place for their kids to be, or to always be leaving their family behind when they do things like this. So it's certainly just the logistics are a challenge, I think. The biggest thing I would say to women coming into leadership is learn to say no. I've always said yes, and mostly I've never regretted that, but there's a real chance of saying yes too often and losing that balance that you've got. And I wouldn't change anything about the places I've worked and what I've done. It's been great. I wish I could have said no to some things when my kids were little and done those logistics better, because I don't think I dropped the ball professionally, but you always feel like you could have done more for your family when they were young. And they had no maternity leave in those days, right? So as self-employed professional in a small town, you took off as long as you could afford. And one of my last child, I had a locum lined up. I was going to take a couple months off, and the locum showed up and looked around and said, I don't really like this community, I'm leaving. So I wound up back at work. She was 4 weeks early. I wound up back at work before her due date. And I only worked part-time, and I didn't do call. That was impossible to cover a merge when you have a newborn, but it was still, I was back at work way sooner than I would have liked. Now we have paid maternity leave for 4 months, and many of my colleagues self-fund and take a 6-month break, and it's well supported. And you know, that's a huge achievement, I think. And it's because people like me and Mary Johnston, who, you know, I delivered a baby the day after I had my own baby. I was still in the hospital. And someone came in fast labor. It was about 6 in the morning, and I was sharing the room with a nurse, and she had gone out for some water, and she came back and said, Mrs. Smith is at the desk, and I swear to God she's going to have the baby in the hallway. So I hopped out of bed and put on my bathrobe and my slippers, and I went to the labor room where they had her at the time, and there's 2 panicked nurses, and I walked in and they said, oh, thank God, here's some gloves. So, and they'd called her doc, but we work from home, and he lived 10 minutes away. So I delivered this baby, and the husband didn't know who I was. The wife did. She knew I was a doctor. And the husband's going, why is this woman in a bathrobe delivering my baby? And, you know, and so it turned out to be quite funny. My colleague showed up by the time I'd got everything under control. The baby needed some resuscitation, and I was getting a little shaky. And he showed up, and I said, good, you can do the rest. But the family was so amused by it, they went to the local newspaper, and I have a clipping of the picture of the 2 babies together, because they were born the same day, right? They went all the way through school together, too. So I'm semi-retired from my medical practice now, and I gave a lot of thought to this as I went through the process of cutting back. And I think the thing I'm most proud of is my medical group in Golden and what we have built there. When I went to Golden, I was the only female physician in a practice of 6. So there were 5 men and me. And there had been 2 other women before me that hadn't stayed very long. And we got a locum when I had my 2nd child, who was female, who stayed. And so for a while there were 2 of us in the practice. And now in Golden, over half of the medical staff are women. And we have doubled our medical staff, so we have about 12 to 13 family physicians, and over half are female. And more than that, they support each other. We have built a culture of looking after the other doctors in our practice. And I and two of my male colleagues were very intentional about this. We do a lot of teaching. We recruited people that we had taught. We recruited people that were a good fit for our philosophy. And our philosophy is, you're not in this alone. And if you are in emerge and you need help, you call. And when I went there as a new grad, they said, call us for anything. And I did, and they always came. And we now do that and look after each other. And that's why we're relatively well staffed, why people stay there. They might come because it's a beautiful place. They don't stay because of the scenery or the recreational activities. They stay because the practice is a satisfying place to work. And I'm very proud of that.